Well, I'm not sure there are typical candidates, but what is typical is we all age in more or less the same way. And there are two main types of facial aging. The first is that the skin itself changes in quality. So you have the results of environmental toxins, the elements, cigarette smoking, etc. And that's the sort of thing that gives us fine lines and sunspots and other changes related to the sun. The type of aging that is particularly treated by facelifts is what's gravitational aging. In other words, as we get older, literally our face slowly drops, and it literally falls off our face, literally does fall off our face. And so, of course, that happens in a very predictable way, and as we all enter our 40s and 50s, there's some laxity of skin, particularly in the neck. The jawline becomes less clean, the nose to mouth lines become deeper, the mid-face, the cheekbones become a bit more sunken, and in the upper face, the brow drops, becomes more hooded. And for a lot of women, although men as well, the changes initially sort of people become aware of the changes, not because they suddenly think, oh, I look old, but they will begin to look tired, even when they're not tired, or they will look angry or stern. So aging tends to do that to us. And although men age in exactly the same way, the effects are obviously are often not quite as profound in our 40s and 50s, because men already look a bit stern and they're already a bit square, and so it's a more subtle change that happens to men in middle age. So the typical candidate, if there is one, is women in middle age who suddenly look in the mirror and think that they've lost their freshness and femininity and youthfulness, and feel that they look tired or sad or angry, and feel that for a variety of reasons this is something they'd like to deal with.